Hi guys, so I feel like I'm providing a public service here because I really am angry with people like this. This is talk radio, where they undermine public health. And when you undermine public health, you put lives at risk. Here we have Ian Collins, who's interviewing on how to deal with the pandemic, who other than a member of the UKIP party. What they have is you have these people who are surrounding themselves with people who agree with them politically. They start off with pseudoscience and they ask their commentator, their caller, to reinforce that. This is dangerous and it's undermining public health. Now we can let's hear what he has to say, and I'll come in with some commentary.
And of course, the other breaking news which ties in with all of this, well, the question we're asking is, has the world of science lost the plot?
Has the world of science lost the plot? The world of science. So he's not actually attacking science. He's not attacking the data. He's attacking the world of science. In other words, he's attacking scientists. And we've seen this before, how they will say, also on this channel, talk radio, they will insult the chief medical officer or the experts providing data to the government. What is their agenda? What are they trying to achieve? Why are they taking away people's freedoms? Attacking the scientists, because they can't actually attack the data, because they don't have the competences to do so. People who can analyze data have a certain skill. The vast majority of the population don't have that skill. So we have to rely on them to provide us with the data correctly. What these commentators do is that they don't actually listen to the scientists. They don't look at the data. They listen to other politicians or people on their side. So let's attack the scientists, not the science, because you can't attack the science.
444991000. And in the last hour, Wales's First Minister has announced a 17-day lockdown across Wales from Friday evening.
A short, sharp shock to turn back the clock, slow down the virus and give us more time. We met again this morning and we have now reached the difficult decision to introduce a 2-week fire break starting at 6 p.m. on Friday this week.
That's Mark Drakeford, who said that people will be told to stay at home while pubs, restaurants, non-essential shops will be forced to shut. Gathering indoors and outdoors with people not in a single household will be banned as part of the fire break. There's that word again. Let's speak with Neil Hamilton.
What's the problem with that word? I actually prefer the word lockdown. Do a full lockdown. I disagree with Ian. Ian doesn't want to have any lockdown. I think you need at least a 1-month lockdown to really get your hands on this virus. But these people don't want any lockdown. What's interesting about them as well is that they will attack the solutions provided, but they will never provide their own solutions. This is something you find very, very much on the right. If you present a solution to a problem, they will attack that solution, but they will never actually present their own solutions. Now, one of the possible solutions that they generally, it's not really a solution, but they throw it out there, is herd immunity, but we'll come to that later.
Former UKIP interim leader and Welsh Assembly member for Mid-West Wales, Neil Hamilton.
So we want to get to the science. So let's not ask a scientist. Let's ask a politician.
Afternoon to you. I mean, first, is it a fire break, a circuit break, a hand break? What is it?
Let's undermine the language, of course. Let's make a joke of all of this. This is because it's all a big joke. They don't take it seriously, so they don't want you to take it seriously. Like, I'm an advocate for a lockdown, but I understand that it has a deep impact on people's lives and livelihoods. Many people lose their jobs. Many people's means to live is undermined with a lockdown. I accept that completely. But I think we need to do a lockdown. Otherwise, our hospitals are going to be overwhelmed. And then we're going to have a shit show, basically.
Well, of course, it's not a fire break. It'll just delay the transmission of the virus by a bit. Obviously, if people aren't in contact with other people.
So he agrees with me. It's not sufficient. It should be longer.
Then it's more difficult for a virus to spread. But as soon as you lift the restrictions, then the infection rates will start to rise again. this is so patently obvious, then unless we're going to commit ourselves to permanent lockdown forevermore,
no, it doesn't have to be permanent. This is their response as well. Oh, well, then let's have an indefinite lockdown, a lockdown forever. That's not what the scientists are suggesting. The scientists are saying you need to have a lockdown until the numbers are down sufficiently that you can implement a test and trace system. So that when numbers are very low, you're able to track the people who are spreading the virus, and you're able to isolate those people. So if you actually did it right from the beginning, then you wouldn't need to be continually doing extra lockdowns. The problem is people like you were saying, we don't want to have a lockdown. So then there was pressure from the right on the government not to have proper lockdowns from the beginning. And then we have to have all these other lockdowns after. So, the people to be blamed are you people.
Until either we're all dead or a virus is invented, then...
A virus? I assume he means a vaccine.
What's going to happen is that Britain will remain as a kind of open prison or series of gulags around the country with borders that we can't lawfully cross.
And whose fault is that? I had advocated for a longer, stricter lockdown once, and that would have helped deal with the pandemic. But you people were against that.
And the economy is going to crash, and millions of people are going to suffer, not just economically, but also in terms of their mental health and physical well-being as well.
And what do you think would happen if we just let it run rampant? What do you think would happen if we just said, let's just take no measures? Just let people... Let's get rid of social distancing. Let's get rid of hand washing. Let's just let people do whatever they want. What do you think would happen in that scenario? Do you think hospitals would be overwhelmed?
We know that there are masses and masses of other serious diseases and conditions which have gone untreated and undiagnosed as a result of the emphasis which the NHS has put on COVID. This is a zero-sum game. I mean, there is a real price, a real cost to the kind of policies which are being imposed upon us.
And who has said that that's not the case? You're engaging in a straw man argument here. The idea, the other people are saying, well, we just do a lockdown and everything will be perfectly fine. Nobody's advocating for that position. You're just inventing a scenario and then attempting to say, look, see how pointless this type of argument is.
By governments that want to control us and everything around us.
What do you suppose is behind this then, Neil? I mean, Mark Drakeford's not a stupid person. Who's he listening to here? Maybe he is, by the way.
It's the same kind of people who are advising David Cameron, the so-called...
What do you mean, David Cameron? Sorry, I think this guy is a bit out of date. We've gone from David Cameron to Theresa May to Boris Johnson. Maybe he's still stuck in... I don't know, when was David Cameron? 2010? 2015? Maybe 2017? I don't know how far. I can't even actually remember when Theresa May took over.
Experts, but they're actually just professors of guesswork because they've no idea what the infection rates are amongst the population.
They have no idea. So you know, but they don't. You know that they don't. So I assume you do know. Although technically it's possible to know that somebody else doesn't know something. You don't need to be an expert on that. But you're making a pretty big assumption here. You're assuming that these people who are advising the government don't understand anything. My problem with them is not that they don't understand, it's that they're not being listened to. That's a big difference.
The R rate is a meaningless statistic because we don't know what proportion of the population has a latent immunity. We don't even know how many people have already had the virus without even knowing it and are now immune. So,
what do you mean are now immune? Why is Ian Collins not interrupting here and saying, oh, wait a minute, no, what you're saying is wrong. We don't know anything about immunity. You can't say that some people are immune. There's no data to support that once you get it, you become immune. There is data. There is not a lot of data, but there is data to point in the opposite direction, to say that people who have become infected recovered and then got reinfected again. So there's no scientific evidence to support this idea of immunity.
I'm afraid that these draconian lockdowns are just like a giant pair of asbestos underpants to protect the backside of politicians.
Yeah, I wish I'd said that. That's a great way to describe it. Do you think there has been, Neil, an overemphasis? I mean, we have to listen to scientists and clinicians, obviously.
Then why are you not listening to them now? Why aren't you interviewing one on your radio station? Why the hell are you talking to a UKIP member from Wales? No offence to Wales, of course. My criticism is of UKIP. What the hell? Why are you interviewing a UKIP member and not a scientist? Like, it blows my mind. He's like, yeah, we should really listen to scientists. We should also listen to what they have to say. Now let's interview a member of UKIP.
But has there been too much emphasis put on the science advice? Because
we have to laugh, otherwise we cry. Has there been too much emphasis put on the scientists, on the science? In the same way as, when we looked at climate change in the past, well, we still look at it, of course. But in the past, we used to listen too much to scientists, and we didn't listen enough to, for example, oil barons or maybe right-wing politicians, because their opinions on climate change are just as valid as people who have studied years and years and written papers on this topic. What's the point in, we should have a balance, okay? We have people who have studied years and even decades, written papers, have PhDs in that particular part of scientific field. And on the other side, we have people, who run businesses, who, extract oil from the ground, or we have politicians who agree with those business people. We have to have a balance, of course.
As I begin to look...
apologies for anyone who doesn't understand sarcasm.
Look at this story unfold, and I look at the way the science advice has changed very much. Don't wear a mask, do wear a mask. Lockdowns shouldn't happen too early.
These people don't understand the scientific method. Science is not something static. It doesn't say, this is how things are. It's a model. It's about understanding reality. It's understanding the world that we have around us. Some things, when we have new data, the model changes. What is so difficult to understand about this? They seem to say, well, oh, look, the scientists told us that wearing a mask didn't help. Now they're saying it does. Oh, that means that they were wrong, or that they cannot be listened to. No, it's about understanding something. At the beginning, they didn't understand how the virus was spread. They thought maybe wearing a mask doesn't make any difference. They did models, they tested it out, and they discovered actually that information was wrong. So they adjusted. This is the scientific method. It's been used for centuries. That's how science works. You try something, you build a theory around that. And I'm not the best advocate for this because I'm not a scientist. I'm just going by what I know. But you build models around things that you know. You test them. If new evidence comes along that changes that, then what do? You change according to the evidence. You don't sit in one position and say, this is how it is forever. That's how the scientific method works. These people don't understand that. And unfortunately, I'm not the best advocate or the best person to explain it. It's best to listen to a scientist, not to me, and not to a member of the UKIP party.
It should have happened earlier, etc. I look at that and I think, do these guys actually really know any more than the rest of us when it comes to coronavirus?
Once again, we're back to a member of the public knows just about as much as climate science as someone who has studied climate science. Would you apply this to any other situation? Let's say, let's say, for example, we take an English professor, somebody who has studied at Cambridge or at Oxford, has written papers on the English language. Would you hold their opinion on, for example, grammar structures or syntax to the same level as a member of the public? No, you would not. It doesn't even have to be language. Let's say heart conditions. Would you listen to a cardiologist or would you listen to your car mechanic? No offense to car mechanics. Just take a random example. Who would you listen to more? The same can be in the reverse. would you listen to a car mechanic about fixing your car, or would you listen to a cardiologist? Do you understand the difference here? Just taking random people off the street and asking them about a lockdown is ridiculous. It's beyond absurd.
Well, they're not being guided by the science. I mean, who are the scientists who are saying this? It's certainly not Professor Sunetra Gupta, who is the leading epidemiologist at Oxford University, or Sir David Spiegelhalter, who is at Cambridge, or Professor Hugh Pennington, who's the Emeritus Professor of Epidemiology at Newcastle University, or any of those who signed the Great Barrington Declaration.
So this is this great declaration that the right wing continually pump out. So they've taken a selection of scientists. Also, some fake people have signed it as well. It was I don't remember all of the names. They were really funny names. Some of them taken from The Simpsons. So you've gotten a group of scientists to sign a paper, and that's evidence. It's not. Once again, it's not the scientist that's important. It's the evidence that's important. The right wing will say, "Oh, how dare we shouldn't be listening to these scientists. Now let's listen to these other scientists." It doesn't make any sense. It's a contradiction. Of course, they continually engage in contradictions. But they will say, in the same bloody interview, we shouldn't be listening to scientists. Now let's listen to some scientists. The problem, my position is, listen to the science. Of course, the scientists are the people who interpret the science and are able to present it to us. But if they are contradicted by others, then we have to look at the contradiction. We have to understand who is telling the truth, who's interpreting it correctly, and who is not. Now, a lockdown is different from the virus. The lockdown is a measure to deal with the spread. So, is a lockdown perfect? Is it science? Probably not. It's a social tool. It's a political tool, maybe in some senses as well. It's not scientific. A lockdown is not scientific. It's a suggestion on how to deal with the spread. But unfortunately, I don't think these people understand that.
Thousands of competent, real medical scientists. What the government is doing is listening not to...
So you're saying that the people who are providing evidence to the government are not real scientists? Once again, I don't care about the scientists. I care about the science.
Scientists, but to mathematical modelers. And mathematical modeling is not science. It's guess.
Some of the people provide... Why is it? You think that it's just... So what you're doing is you're cherry picking. You're saying, let's see, we have 10 scientists providing evidence to the government. 2 or 3 of them are mathematical modelers. Let's pick on those and say, see, these are not scientists. They're mathematicians. Do you not think mathematicians are also important in dealing with a lockdown, in dealing with how something is spread? They have a different competence to the other scientists. Isn't it better to have a group of different competences together to deal with something?
It's garbage in and garbage out. That's why when Professor Ferguson of Imperial College predicted in an early stage of this that there might be 500,000 deaths as a result, it gives you an idea of how preposterous some of these predictions.
They give scenarios. They say, if we don't do something, this is what's going to happen. So now, they actually listened to what the scientists were doing. Not enough, okay? The government I'm talking about listened. They cherry-picked and said, okay, let's try and do this, let's try and do that. And they mitigated the damage. Someone like Ferguson, I'm not sure which article they're referring to here, or which prediction he made. But if he made a prediction like there's a possibility of 500,000 deaths, if we don't do anything, and the government did something, then you can't say, well, then he was wrong. Because you did something. You changed direction according to maybe his advice or the advice of other scientists. This idea that somebody said, if we don't do anything, we're going to have a disaster. The government did something, not enough, but they did something. And you didn't have an absolute disaster. I think it's still an absolute disaster, but not according to these people. How is that a validation of your opinion or your position?
are. I had a meeting with one of my health authorities, which covers the whole of southwest Wales, Pembrokeshire, Carmarthenshire, and Cardiganshire, on Friday. And there are 3 people in hospital in Llanelli with COVID and 3 in Aberystwyth. And one of the 3 in Aberystwyth had been brought up from hospital in Swansea.
So now the response is, well, look, not so many people are dying, so we don't have to do anything. This is not the problem. The problem is the spread. If fewer people are dying, isn't that something positive? Like, what they do is, look, we have this lockdown and fewer people are dying. That means we shouldn't have a lockdown. No, fewer people are dying because we're able to deal with the pandemic much better. We're able to understand it better. We're able to treat people sooner. Everything that, what they look at, what I see as somewhat of a success, they see it as a failure. We understand this pandemic much better than we did months ago. We're able to treat people better. We're able to treat them sooner. We're able to understand a little bit better the spread. So we're actually doing much better than before, thanks to our understanding, thanks to these measures that we've imposed. I see it as somewhat of a success, and I don't mean it as a success, and I take nothing away from the damage and destruction it has done to the economy, to people's lives, and the people themselves who have died from it. I'm taking nothing away from that. What I'm saying is that the situation is much better now than it was before because of our understanding, because of science. These people see it as a failure.
This is an area which covers, I don't know, 500,000 people or something of that kind. And that's the real, not just infection rate, but people who are seriously ill.
It's now been locked down. Because
it doesn't really matter how many people are infected, so long as they don't experience any real adverse.
Of course.
It doesn't matter how many people are infected. Is Neil Hamilton a scientist who can make this accusation? It doesn't. This is mind-blowing. It doesn't matter how many people are infected, because not so many people have died from it. He's just basically throwing the science out the window and saying, look, it's not so many people died, so we can just go back to normal. Fewer people have died because we understand it, because we introduce these measures. If we just allow it to run rampant, you're going to have much more deaths. That's a certainty. What is wrong with these people? So I'm not going to show you the entire video. I'll leave a link in the description if you want, because this is going to go on forever, because I'm going to have to stop them every bloody 10 seconds. But what their goal is what is called herd immunity. Now, herd immunity is not the way to deal with this pandemic. Now, I'll show you here. You can see it on the graph. Let me just check that you can see it. Yes, you should be able to see it. So herd immunity is where you see here in the blue, we have people who are not immunized, but still healthy. Then we introduce some infected people. So we have yellow, which is immunized and healthy. And then we have not immunized, sick and contagious. So we introduce a few people into the general population, where remember, there is no vaccine, and see what happens. Now, not all of those people will die, because some people have different levels of health. So many people will survive, but some people will die. Shouldn't we be trying to reduce that? So if we have immunization, so we see here the yellow people are immunized, while very few in the population are actually immunized. We have a certain level of spread, but it is reduced in comparison to the first graph, the first graphic. Then finally, most of the population is immunized, so the spread of the contagion is limited, is contained. So you can see here there are a few infected. But for example, the blue people who are not immunized and healthy are protected by the herd. Okay, now we don't have a vaccine, but these people are saying that we should go with this model, the first one. Just let it run rampant. If people die, well, that's, People die anyway. You know, people get hit by cars every day. This is their response, not my response. This is their response. You know, people die every day on the roads, you know, smoking, whatever. So we shouldn't really do anything. This, again, is their response, not my response. The best situation is where we have a vaccine. Now, at the moment, we don't have a vaccine. So until we have a vaccine, it's important that we take measures to limit the spread. These people do not. They don't care about ordinary people. They don't care about the science. It's all about political posturing. It's about gaining some advantage over their political opponents, using this as some sort of political football, which is disgusting and abhorrent, because you're playing with people's lives for your own political gain. He's not a Tory. He's probably worse than a Tory because he's a member of the UKIP party. But this is the type of people we're dealing with, and they're given a platform by the likes of Ian Collins, who agrees with everything that Mr. Hamilton had to say. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot. I want to say a big thank you to all of my patrons. You ensure that this channel continues to exist. I'm eternally grateful for all of your support. If you join Patreon, you will receive instant access to our Discord server, where we have both audio and video chats. You can chat with me and other patrons, where we discuss important and non-important issues. Becoming a patron per month costs about the same as a large coffee, so why not check it out?